Opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Oh, I'm here. Oh, and who's this other guy sitting across from us on the phone?
That's Brother Mikey.
Brother Mikey. Mike Restful, who's the office manager over there at Dr. Mencia's. I was waiting to tell you
How
something.
How you doing, Mike?
Good morning. Good morning.
Listen,
Thank you.
I didn't tell you while you came in. I wanted to be a surprise. I went to make a speech I guess it was on the border of Delray and Boynton Beach, a big community. And I'm making my speech. It's called The Illusion of Aging. It's my new speech. And so we're talking about the radio show, and a woman said, she raises her hand, she said, I listen to you every Saturday morning. Dr. Mencia. She said, I wait for Dr. Mencia. So really, it was like wonderful. And then everyone know when, where, what, and of course she had to tell everybody. So we have a lot more listeners this morning from that wonderful community. But it is, you're becoming,
that's a nice
It
topic.
was really nice. Oh, the illusion of aging.
Wow.
You know why I did this is because everybody really they don't see themselves as their age, right? Nobody. You ask anybody what their age is, and we're going to be talking about how they look, and that's very important that we're going to segue into this. If you see all these people with colored hair, I'd be sitting here with white hair now. I wouldn't have nails. People, plastic surgery, everything is different today. It's an illusion.
I will close the door.
But it's an illusion. It's an illusion of everything. And I remember when I just came back from a big entertainment center, I was impressed with the man that does an illusionist. I saw the tiger. I saw it in front of me. I was sitting in the first row. All of a sudden, it goes in a box, and it's not there. Now, I know it's somewhere. I just don't know where it is.
Somewhere in space.
Yeah, but that's what it is with people now.
Right.
And you know what's happening to me? A lot of the communities, because I've been speaking lately to places, and the first thing they say is, now, Anita, I don't want to talk about any old people or old things like that. We're a young group. We're boomers, and most of them are 70 and probably older. We're a young group. We only want to talk about upbeat things and how we can live longer. Is that what your patients say to you?
Improving the quality of life.
That's what they want, improve their quality of life. That's exactly what people want. And, especially in our country, we try not to discriminate. Because, there's different type of discrimination. You can discriminate against race, against sex. But when you discriminate against age, it's called ageism. So I get a patient that came to see me. She's 89, and she wanted to do some filler in her face because she lost weight. So she wanted to rebuild her face with filler, and she wanted to do Botox. And I say, sure, why not? No problem. And he say, oh my God, Dr. Mencia, I'm so happy I came to your office then, because she said I went to another office, and they kept questioning her. Are you sure you want to do this? You're 89 years old. Are you sure you want to do that? Of course, you have the right to make yourself feel good.
And that's really why I'm so glad you brought Mike with you, because I've been a very big proponent of people to take care of their teeth, but more to take care of their mouth, because that is not only for beauty, it's for health, isn't it, Mike?
It is. It's very interesting. We talked about it before at Adult and Geriatric that Dr. Mencia, we treat the entire body, including the mouth, where we start with. I'd like to read something. I have an interesting article I just read this week. This will say it all. Let me just read this. Excuse me. Oral health affects people both physically and psychologically. Poor oral health influences every aspect of life: enjoyment, appearance, speech, obtaining proper nutrition, and social well-being. Missing teeth that is not replaced with a prosthesis has shown to result in reduced quality of life comparable to the effect of cancer or renal disease on a physical well-being scale. It's so true, the patients that we see. We have a lot of elderly patients come in. Their family tells us, my dad hasn't eaten, he doesn't speak, and 99% of the time it's due to improper oral health care or loose teeth, pain, dentures that don't fit any longer. So this is what we wanted to talk about today, improving that.
Sometimes they put a denture on just to go to the doctor.
Exactly.
They take it off.
Really?
And they take it off, and I hear from the kids telling me all the time, Mom or Dad just put on the denture to go to come and see you, and then as soon as he or she is in the car, they take them off because if they bother them.
They don't
fit.
But
the other thing I've seen in restaurants are people have their they have the I guess false teeth in their dentures, and they're chewing, and the dentures are going up and down, and then they're embarrassed. Some of them turn to the side, they take their dentures out, put it in a napkin, put it in and I know people listening are saying this, all right, so there's got to be some better ways, right? Well, they can have a new pair of dentures, maybe. They can
do even better than that.
Yeah, they can have. All right, they can have full implants with it's not easy for an 89-year-old to do it, but I think you've come up with something that's kind of the halfway in between.
We have a method that we've been using in the office. It's called the mini implants. And the word mini is good. I like it because it's not as expensive as a full-blown implant. It's not invasive either. It's very easily done, and my whole staff have now been trained on that. And myself, I sat in just to learn from the medical point of view. I wanted to learn what is it that I was going to recommend my patient to have done. And it's interesting, Mike, because, when you look at implants, no implant, just denture in general. When you look at denture, it's like a person losing a limb.
Good point.
It affect your quality of life.
Right.
And affect your image.
And men, as they age, they want to be sexy.
Right.
I mean, women do too, but men, I know, but men, but men.
Don't put down my women.
Listen. I know we have to have a little sex in this show. I'm not going to let you do it without sex.
We cannot talk about implant without sex.
Oh my God.
No, but really,
I guarantee
not having good teeth is not sexy. I mean, it's not sexy.
No.
And people have to realize that, besides, I know it's healthy to have the good teeth, but I want to talk about women spend a fortune on their hair. They have their nails done. They get their clothing. And now they're going on a cruise, and they can't even put their
they won't even smile. I see it every
Now they're going to meet a guy if they can't even smile.
But you know something? I read all the material, Mike, they gave us, okay? Talking about sex. I read all this material, all this stuff. Listen to the lecture. The guy that came from California, we listen to the guy that came from Miami. We are listening about all the implants. So I put one on my patient. They say, you will be an ideal candidate. You should go for this mini implant. So she went up there. We gave her a great price. And she came back and she said, I'm so happy with this mini implant. I said, I told you, you see that?
She met a man.
No, she has a man already.
Oh, okay.
She has her boyfriend.
She
said, Dr. Mencia, the best thing you never told me. I can kiss my boyfriend now, and I don't even have to worry about my teeth anymore.
You don't have to take them out.
Oh
my goodness.
Sorry if I bite you.
I'm sorry.
It wasn't me. It was my denture.
Mike, I know you want to see serious. We can't be serious.
No, I know. I work with this guy. I know.
Okay. Well, all right. We can be a little serious. No, seriously. Okay. So, tell us about this new Snap to Use and Maintain.
All right. Let me talk about what this is for. For our friends who wear full dentures right now, everyone knows those problems using adhesive all the time. They flop around in the mouth. They, like you just said, they take them out to eat. They only use them when they have to go out. We bought in a system, the mini implant system, that does away with the adhesive. You don't have to worry about taking them out. They're not going to flop around in the mouth. Very simply, without getting into all of that, this mini implant system, they're very small. They're like a half an inch long. We strategically will place a few implants. Every case is a little different. We strategically will place these implants, convert your denture or a new denture with these attachments, and they will basically snap right onto the implant. So there's no more adhesive. There's no more moving around the mouth. You can talk with them without them moving around. It's a great system. It's, as Dr. Mencia said, it's not as invasive as the full blown implant.
Okay,
These
Mike,
are
I'm
much
looking
smaller.
at a picture of this magazine that you just brought. I mean, this picture is pretty gruesome with just, I guess there's 6 teeth there, and then there's some, I mean, pretty bad. And all of a sudden now you put the dentures in, and the person looks different, but we know that if they were to come out, this would be terrible. So you're saying, and because I'm not in that business, I have to understand this as people listening. How there are two? Is it like it's almost like roots going in your? It's not a root, but it's something in there, and now it adheres to these implants. These little. How many implants do you have to do? How many?
It's
do you
almost
have to put
like
in?
a little ball hitch type of deal, and
So it
these
grabs
attachments,
onto
and it just snaps and grabs onto that implant. The
So how
patient
many
can
do
take
you
it
have
out.
to have?
Every mouth is a little different. Depends on the size of the mouth. Sometimes we put 4 implants, sometimes 2 implants. Everyone's a little different on the level of bone. So there's a couple of procedures we need to do during the consultation to see which one is best for that patient.
It's custom made.
Yes.
So they bring their dentures in with them. Let's say they have a very good pair of dentures.
Right. They have to.
And then you look at the dentures. And then you figure out, Dr. Rosemary, it's not you doing this. Mike is wonderful, and he is the office manager, and he works very closely with the dental department. And you'll love him. He is the sweetest, most gracious person. But in Dr. Rosemary is really the genius, and she's the woman she's the dentist who has to decide really how many. Yeah, she's the artist, exactly. So you're saying that they come in with what they have, she takes x-rays, and then what happens?
Well, the first step is we need something called a 3D scan of the head. We have a company that will come to adult and geriatric and do this on the premises. What that scan shows us is the level of each person's bone and where those nerves come in and out of the jaw, which is very important when you place an implant. Obviously, not to perforate a nerve or an artery. So that's very important. That's the first step. Once that scan is done and we see that level and where those nerves are, then we can decide how many implants we're going to use. And just like you said, if the denture is fairly new and we can convert it, fine. But if you have an old denture that's been worn down, and most of the time that's the case because that's why you're not wearing it, well, construct a new set of dentures to go with those new implants. Very simple.
Yeah, when we look at the jaw, when we do the 3D imaging, we look at the jaw, and the bone has some hills and valleys.
Exactly.
As you go through the jaw. So you do not want to put an implant in the valley because it's too low. You want to put it on one of the hills. And sometimes the patient come and they say, "Oh, Dr. Mencia, that's not for me. My previous dentist told me that I have no bone left," and that's not true. When you do the 3D, then you can see where you have enough bone on this side and on that side, and those are the area where the mini implant will go. And once you get that put in, you have a new life.
But and I have to say to all our listeners, you know that Dr. Mencia is the medical director. He's the founder of the Adult and Geriatric Center, and he's the doctor there. So now you're going to have this procedure. It's not that it's dangerous because they are being done other places too. It's very high tech. It's wonderful. It's cutting edge stuff. But there's Dr. Mencia, and if you're a patient of his and he knows your history, he may say to you, "I don't want you to do this." He may.
Oh, absolutely.
You never know.
Yeah,
you may be on, certain times. Maybe he won't. Rarely, though, because most of the time he's very progressive, and he figures out a way.
The protocol that I have there, because we have several dentists that work there, and the protocol that I have set up with Mike in the dental department is that whenever the patient is having any procedure and the patient is required to go under anesthesia, I have to be on the premises.
Right.
I want to be there.
Fantastic.
I want to make sure I supervise whether my patient or one of the other doctor's patient. I want to be there just to make sure that thing will run smoothly.
I love that. This is rare. I don't know of another place. And so that's one what makes you feel comfortable too, doesn't
absolutely.
it?
His patients feel a lot more
And
comfortable when he's walking
also,
around. When we're doing that type of
yeah.
procedure, if they see him, he pops his head in, and they know he's around the premises. They're comfortable, relaxed. It makes our job a lot easier.
Okay, so let's put someone in the dental chair, and they've had the X-rays, and Dr. Rosemary knows exactly what she's doing. From the time that she first does this, until they can start eating again, or they tell me about that.
Most cases within 2 weeks. If we're going to use your denture, first step, the implants are done within a couple of hours. We'll give maybe a week to heal a little bit, and then we bring you back and convert the denture. No more than 2 weeks. Of course, if we have to make a new set of dentures, it's a little bit longer. We do that in steps, but from start to finish, in most cases, 2 weeks, if that. It's just amazing. Like I said, it's not as invasive. They heal a lot quicker. And we've done some cases, and they're beautiful. And again, like I said, those people know what I'm talking about when that denture is moving around in the mouth. This will do away with all of that. This is affordable.
And also the aesthetic, Mike. I mean, when you see a person that spend most of the time without their denture, they start building lines around their mouth,
right?
Because of the fact that they have some, no teeth in their mouth, they are dentures. So by having no teeth, then the mouth starts building this deep crescent, these deep lines in the skin, and make us look older than what we really are.
Well, you're going to laugh at this probably, but when someone has this problem with not having, able to eat, they also then hide.
Right.
Yeah. They hide. They don't go out. They become a hermit. They don't want to go anyway, and they make other excuses. They don't say that. They say, I don't feel well. I'm not going to do this. Now their hearing starts to go because they're not listening to anybody anyway. I mean, and some people even think these people have Alzheimer's. I've seen it. And you've seen people where they say the family says, we're going to put them in hospice, and after you examine them, you told us those stories.
Well, exactly.
And when it maybe just is the whole thing started with their teeth.
Exactly. One of the big things I hear now, of course, with the economy and things, is people say, I can't even go look for a job. They're missing all these teeth. I mean, think about it in an interview. I have a lot of women come in, and they said, I'm embarrassed. I can't even go look for a job right now. And they can't afford to do all cosmetic fix, bridge work, and all this other stuff, crowns and bridges. But this maybe is an alternative. You're missing all these teeth. This is surprisingly affordable. Somehow it can be done.
Well,
from the medical point of view, is that when you look at, you study any book in digestion, gastroenterology, they all tell you that digestion starts with your teeth, by chewing the food. So if you don't have enough teeth in your mouth to bite on that food and you start chewing the food, you're depending on the rest of the intestines to do all the work for you. And that won't do it.
That's a very good point.
I'm sure that causes a lot of other problems.
Swallowing a big chunk of meat.
Right.
It's difficult to go down.
Right.
Once you go into the stomach, digestion will start, but that meat will come out undigested because the body cannot do that.
Right. There's no reason people can't eat what they want. There's
a way to do this. So let me give you the phone number for Mike.
Yeah. Let's do this. Okay, the phone number is 954-489-1345, and I'm going to repeat that again. Of course, it's in Broward County, so that's the 954, and it's 489-1345, and it's called the Adult and Geriatric Medical Center. It's located at 1608 East Commercial Boulevard in Fort Lauderdale. It's just a little bit west of the Holy Cross Hospital. Maybe it's time now for us to just kind of share for some people who maybe haven't listened before, those poor unfortunate people. What actually is the Adult and Geriatric Medical Center? What does it do there?
It's a center where the patient is take the center stage during their care, and what we do is we cut off on all the miscommunication between providers. The patient comes as like all-inclusive under one roof type of medical care. It's very modern. We have dermatologists, podiatrists, neurologists, dietitian, hypnosis, psychologists, ophthalmologists, internal medicine, geriatric medicine. So it's all inclusive. We do lab right on the premises. Lab get done there. So a lot of time when the patient come in, by the afternoon we have the result of the labs. If it's something critical, we don't wait for the next day to call the patient. We on top of it right away. And also the ultrasound. We do the ultrasound. So,
one thing you forgot, people are very friendly. They're very
staff,
caring.
Yeah.
They're very loving.
Right. The staff, we've been blessed with wonderful staff. They all get together nicely. There's a lot of harmony. And usually when I have meeting, Mike can tell you, we have meeting with the staff, very frequently. And I tell the staff, this is home for us. We spend so many hours here that most of us just go home to sleep. So this is really home.
And the nice is
and now we open on Saturday, so that's home for
on
us.
Saturday. That's right. So if any of you can't get there during the week, you can go see Dr. Mencia on Saturday. I mean, this is a very dedicated physician who takes his Saturdays away from his beautiful family to go there because they just don't have enough time to meet everyone during 5 days.
And my dog and my horses.
The dog and his horses.
He'd work Sunday too if it wasn't for the family.
No, I know.
Well, I already have somebody. One of my assistants said, Dr. Mencia, if you open on Sunday, I'll be in.
But something I have to say, the reason Dr. Mencia needs Saturday is because he takes so much time with the patient. If you just had like some medical places, practices, they have 5 minutes in this room, out that room. Dr. Mencia doesn't do this. And so he does take more time. It may be 10 minutes, 15 minutes, 30 minutes. Whatever he knows you need, he's going to give you. And I just have to promote that about
my assistant will not let the patient leave the room. Sometimes you see the patient like leaving right after me, and the assistant say, sit down. Let's review your medication. We want to make sure everything is in order. They will not let you go every visit, whether it's a week apart. Because a lot of things can happen in one day in one person, healthcare. And even if it's a week apart, they say, okay, let's review this medication. Let's make sure that you're still on the same thing that you were taking last week. And one of the beauty of being open on Saturday is that prior to this, when I would come in on Monday to work, I get patients that say, Dr. Mencia, I was sick on Friday. It was kind of late, so I didn't call in. And then Saturday I was getting worse, so I went to an urgent care center.
Yeah.
And I would see what the damage that would happen to those patients during that urgent care visit. And I say, you know what, I better open on Saturday because it's just that they don't know the patient. And they don't know all the medication the patient is taking. And sometimes the medication that they pull you in might do more harm than good, might interact with the other medication. And then here I will come on Monday to do damage control. I say, hey, this is not fair to my patient or myself.
No,
I say, just put in one extra day, it has made such a big impact.
You're very dedicated, and again, I'm going to give the phone number to make an appointment. You can call now, actually, and they just leave a message or call at 9 o'clock.
If you place 0, you get the operator. We have a live operator, Sandra, that will pick up your call.
All right.
Always.
Now?
Yes.
Actually,
always.
It's 7:30?
7:30. It's around the clock, 24/7.
Somebody
We
will
have a live operator.
This is wild. Okay, 9-5. He's going to want to set up a room here at the studio. Come to the studio. I'll take care of you
here.
I can see it.
There's a waiting list outside.
That's true. We'd probably could have a whole studio audience if I allowed it. 954 489-1345, and that's Adult and Geriatric Medical Center. Now, Mike, since you came here so wonderfully this morning, I want to get back to dental only in a few things. Personally, I brush my teeth a lot, but I never had an electric toothbrush. And I think Dr. Rosemary on one of her shows with us was telling me about this electric toothbrush, and I have to have it. And I said, okay, I'll just buy it to please her. I really wasn't. I was doing it in a different way.
I love it.
And then you
love it?
sold it, there. Oh, my gosh.
It's unbelievable.
My husband thinks, I'm having an orgasm standing there. No. I'm using it on my teeth.
Okay, take my case off the record.
Okay.
No. But then after you do it for clean, then you go to shine. And then there's another thing it does.
Polish,
something
massage. Yeah, they do a massage.
Said, what are you doing?
No.
At the sink, I said, I'm brushing my teeth.
No, I've been using Sonicare for probably 15 years. I think it's fantastic.
Sonicare. Do you use it?
I use it, and I have noticed when I go for my cleaning, at the adult and geriatric institute. Of course, when I go for my cleaning and they check for deep pocket, I don't have any because I use the massage and I do the cleaning.
It's guaranteed
I
to
don't
change
do the massage. I'm supposed to be doing something else.
Absolutely.
Yeah, there's a massage. We just massage the gum. There's 5 settings on there, I believe. But it's guaranteed to get better checkups, if you want to say that. It's guaranteed, or your money back. There's a million different type of brushes out there. Don't get me wrong. Oral-B, I don't care what you use, but Sonicare to us, like I said, for 15 years, we've got great results. It's the only one we carry.
And I've been very happy to use that, and I do thank you so much. But I think that's kind of what you all do. You find the very good things.
We do the research.
Yeah.
We do the research. You listen, you go to the store and you look for mouthwash. There are so many mouthwash out there.
Right.
So we do the research to see what
Which
is
one's
junk
better.
and what's okay and what's great. And then we tell the patient, if you want something that is great,
we actually have something new in now. Instead of flossing the traditional string floss, I just got in through Sonicare. It's called a water flosser. And what this does is pulsate water. You can put in mouthwash or water, whatever you like. And instead of using traditional floss, now it's a water flosser, just like a water pick almost. But I just got them in. I have somebody. I have Shaku trying it right now.
If it's good, I want it because I have to use that dental floss with these little things that go through and the stuff.
And I wanted to bring that article today about it. It's just been proven. I think it might be in here. It was just proven that this water flosser does do much better than traditional string floss now.
Like I told my patient, don't use it for your ears. It's for your teeth.
Try anything else.
And I want to say thank you to Senior Helpers. It's a great organization. They have brought me patients to the office, and we're going to get together the honor of Senior Helpers. This is an organization. What they do, they have companions. They are very
and you know what? No, but this thing is, it's seniors who are the companions.
Exactly.
Which is the most. I love them. I've been dealing with them, and they're a wonderful company. Yeah, they really care. They're different.
Right.
Yeah, so that's good.
I'm looking forward in working with them, and they have been a great addition to my practice. It's a very honest, responsible organization, and the owner is very humble.
Yes.
Love this guy.
Yes, I agree with you. I know him, and I had lunch with him. He really is wonderful. Well, I want to just go back over this. So we've had a great discussion on this new mini implant, and I hope that people. I think what we have to do is first go to Dr. Rosemary and get a
consultation. We always offer that.
It may not be necessary for everybody. They may just need something else, but at least it is the cutting edge stuff that you all do there.
And the good thing is when you see Dr. Rosemary and she said, "Well, this will work for you, this will not work for you, I'd rather do this procedure on you," then the person sit down, you are not left alone. Mike will sit down with that person and then go to a strategy. How can this be done? How can it be paid?
Best suits that patient.
Exactly. So a lot of times they don't even have to put a penny out of pocket to get the job done. They can put this on care credit, and care credit that we have in the office, it does not charge any interest on the patient for a full year or whatever period they decide to use.
I have that kind of insurance. I've had a lot of work done with that kind of insurance. I have to have my teeth good. I can't do anything about it.
Come in now.
Well, we've run out of time as usual.
Oh,
sorry.
no.
Yes.
Another hour.
But thank you very much. Dr. Mencia will be back next Saturday at 7 o'clock. And we certainly do appreciate your coming in this morning, Mike.
Thank you.
And I will go Saturday and go see Dr. Mencia and Mike. Are you coming in?
No.
We are
going to start Saturday with dental also coming up.
Because it has been brought up by some of the patients. They want to see if we can have some of the specialists coming in on Saturday because they cannot see them on the weekdays.
I understand that.
I want to accommodate
every once in a while, right?
So
you do it.
954-489-1345.
But you have to do this slower, sir.
954-489-1345. Well, in Broward County.
Don't make love to the microphone, please. There's someone else coming.
Oh, no.
Thank you very much, and we'll be back
Thank you, Mike, for coming.
We're going
Thank
to be
you.
back in a
Thank
minute.
you, guys.
Joe Clark is our elder law attorney. Who?
Patty.
Okay. Elder law attorney is waiting on the line as soon as they'll just take a break and we'll be right back.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.